We're going to continue on. The next, not quite 90 minutes or so, is called Neuromito Keto. And for the next three presentations, the focus is on low-carb diets and brain health, neurological conditions. First up, I'm going to talk about Alzheimer's disease. Then we're inviting Brodie Camborne, who's an exercise physiologist, and she's going to zoom in from the Nowra area and talk about the fabulous work that she's doing with patients, with a group of old people who are getting older, and she's calling it Fiteracy. Severe neurological problems, and that will be a much more personal story. Now, so my talk now is on brain health, and it's about Alzheimer's disease. And what I'd like you to do is put your hand up if you're over the age of 50 years. I'd like you to keep your hand up if you have a parent or know someone in that generation who has a neurodegenerative condition such as Alzheimer's or Parkinson's disease. Keep your hand up or put your hand up if you have concerns about your own brain function. And you wouldn't be alone on that. There's an awful lot of people out there in my age group and older, so aging baby boomers, who are concerned about the preservation of cognition. It's a really important concern for people as they get older. So today's talk is on ketosis and brain function. Ketosis can be achieved in various ways, such as very low carbohydrate diets, so that's what we call nutritional ketosis. Also fasting and caloric restriction. And the use of MCT oil and keto supplements can also help induce ketosis. So the big question I'm asking today is, why might ketosis be good for our brains? And there's this image is taken from the Diet Doctor. They've got a page on the ketogenic diet for Alzheimer's disease prevention and treatment. So in order to answer that question, why might ketosis be good for our brains, I'm going to take a brief detour through epilepsy. The research started here. The question is, how can a diet work like a drug? What are ketones doing in a brain? We've certainly known since Roman times that fasting has anticonvulsant properties. So fasting is one of the things that increases ketosis and ketone availability in the brain. And ketogenic diets have been used for the last 100 years to help people with epilepsy. This is not controversial. But ketogenic diets are seen as the treatment of last resort for people with treatment-resistant epilepsy, so those who have failed medication. Those people tend to be very sick. And the ketogenic diet in these cases is something that's cooked up in a lab, 4 parts fat, 1 part protein and carb. So with a macro ratio of about 90% of dietary energy as fat. And this gives it the reputation as being unpalatable and difficult to sustain. So let's be clear, when the research that was done on children with epilepsy and ketogenic diets, they were not talking about the kind of food that we're talking about at our conference. This is an example of something that I whipped up, lamb meatballs with a bit of halloumi cheese and some veggies and a mash of, it was probably swede with a bit of turnip and a bit of pumpkin. So what are ketones? Why are ketones important to the brain? And well, the reason is energy. Your brain is power hungry. It only occupies about 2% of your entire body body weight, but it takes about 20 to 25% of your total daily energy output. Your brain normally uses glucose, if that's what you're fueling your whole body with. But when glucose availability is restricted, your liver makes ketones, and your brain very happily uses the ketones that are made by your liver. So that those ketones could be coming either from dietary fat or from your body fat stores. A lot of brain energy goes towards maintaining the sodium and potassium pumps that help brain cells maintain their resting voltage. So if the brain is lacking energy, what happens is the voltages change. And in fact, the neurons fire too easily. This is a little bit counterintuitive, but I did explain this in more detail in the migraine talk that I gave in 2019's Low Carb Canberra conference. And that talk is available on the Low Carb Canberra YouTube channel. So the neurons fire too easily and the brain becomes excessively excitable. And this contributes to conditions such as epilepsy and migraine. Over time, this can contribute to damage to brain cells. The next question is, what are ketones doing in your brain? Well, they're actually doing a whole lot of interrelated things. They're improving mitochondrial energy production. They bypass blocks in glucose metabolism caused by impaired insulin function. They switch on anti-inflammatory mechanisms. They reduce mitochondrial oxidative stress. They change the balance of neurotransmitters from neuroexcitation towards a neurotransmitter called GABA, gamma-aminobutyric acid. So it calms down neuronal excitability. It changes gene expression, has effects on energy sensing pathways, and decreases production of something called amyloid precursor protein, also shortened to APP, and decreases something called beta amyloid, which is a fragment of a protein, which is significant for Alzheimer's. So just want you to hang on to APP, amyloid precursor protein, and beta amyloid production, because we will come back to those. So here's an article, Lutas and Yellen, 2013, which gives a good overview of what ketones are doing in your brain. And the word that I want you to focus on there is neuroprotective. Ketosis is neuroprotective. It protects your brain against injury and neurodegeneration. And hey, that sounds like a pretty good thing. So in looking at this question that I'm asking, why might a ketogenic diet or a state of ketosis benefit people with Alzheimer's disease? I'm going to ask and try and answer the following questions. What is dementia? What are the risk factors for dementia? What are the manifestations of dementia? What's going wrong in an Alzheimer's brain? And the so what? What are the implications? Dementia. Well, dementia is just an umbrella term, and it means cognitive decline. And we typically see this in people in older age, and it's the loss of cognitive capacity, the ability to think, to plan, to self-care, and it leads to loss of independence. Today, I'm actually just going to focus on Alzheimer's disease. This is the most common type of dementia, and it's also the one in which the most research has been done in relation to ketogenic diets. There's actually a whole lot of other causes of dementia, including things like Lewy body dementia, vascular dementia, frontotemporal dementia, the Parkinson's syndromes, and so forth. But Alzheimer's is common. About 5% of people over the age of 60 are starting to get cognitive impairment related to Alzheimer's disease, and that's 20% of people over the age of 80. Currently, over 300,000 people in Australia are affected by Alzheimer's, and this is estimated to rise to 900,000 by the year 2050. So those are pretty scary numbers. The risk factors for Alzheimer's. Well, a parent with Alzheimer's disease is a sobering reality for many of us. But the good news is there's a fair chunk of our personal risk is amenable to modification through diet and lifestyle. Up to 35% of individual risk is potentially modifiable. So we're talking about things like smoking, physical inactivity, depression, low educational achievement. We do want everybody to go to ANU. Metabolic syndrome. Now note the presence of metabolic syndrome. It's a really significant risk factor for Alzheimer's disease. So that's midlife obesity, midlife high blood pressure, and diabetes. And as I've argued in some of my previous talks, metabolic syndrome can be reversed. And now in midlife is the time to do it. I think we all know what Alzheimer's disease looks like. It's the loss of the person that we love years before they die. It's not just loss of memory, although loss of memory is one of the earliest symptoms, but also impaired self-care, personality and mood changes. And this comes from damage to the limbic system. And I'd like you to remember this term, the limbic system, because that's parts of our brain. Memory and emotion are really, which are very human things. They're embedded in the limbic system, that part of our brain. So in Alzheimer's, brain cells are dying. There's damage to brain cells, and once they go, they don't come back. And there are multiple pathophysiological processes. There's no one single thing that goes wrong, and it starts years before the obvious cognitive decline. So the cognitive decline might become obvious when someone's in their 60s or 70s, but the process has started decades before. And the processes, these multiple pathophysiological causes include mitochondrial dysfunction and insulin resistance, in particular those parts of the brain that rely on glucose. And remember we talked about the limbic system. Well, the hippocampus is one part of the limbic system that is involved in memory. And that is a part of the brain that relies on glucose. So if there's insulin resistance, what that means is the glucose can be in the blood, but it's not getting into those cells. And the hippocampus can't do its job. So people start to forget. There's also inflammation and oxidative stress and increased amyloid precursor protein and cleavage of this protein to form beta amyloid, which clumps into something called senile plaques. There's also tau protein clumping in neurofibrillary tangles. So Alzheimer's disease, there's a brain energy crisis. And ketones are neuroprotective. Basically, ketones do the opposite of what's going wrong in an Alzheimer's brain. It improves brain energy metabolism. It bypasses the problem with insulin resistance and glucose uptake. It changes oxidative redox status and inflammatory signaling. There are changes to gene expression, and all of these things that the ketones are doing in the brain are beneficial and neuroprotective. Okay, so what? If there's no one single process causing Alzheimer's disease, the practical corollary is that there is no effective medical treatment. There is no one medication that you can take that will help reverse the Alzheimer's process. There are pharmaceutical medications that temporarily mitigate symptoms, but they do not reverse the disease process. However, a ketogenic diet may have some positive benefits for an Alzheimer's brain. So let's look at the evidence for this. Now, we love a good pyramid. Here's a pyramid of evidence. I'm not actually going to bother talking about the basic sciences, the preclinical studies, things like brain cells cultured in a dish in a lab, or the rodent or animal studies. But they're the base of the pyramid, and there's actually lots of these studies. And I can provide references for some of those papers. There are a lot of anecdotes, and anecdotes are slightly higher on that pyramid. And one that I recall actually came from Pete Evans, and this was from quite a few years ago. A report of an old lady caring for a grumpy old man who couldn't find his way to the local shops. She changes his diet, his mood improves, he is nicer and more independent, and her quality of life improves. And later on, right after me, Brodie Camborne is going to talk about the work that she's doing, helping older people change diet and lifestyle, and the effects that that's having on their quality of life. The next level up that pyramid of evidence is the epidemiological data. And this is interesting. So at that university down the road, ANU, some years ago, something was conducted called the PATH study. And here are 3 references. And what they found was, these are the take-home messages, my digestion of looking at those papers. The damage is being done at blood glucose levels that we regard as normal. So the blood glucose levels that are associated with hippocampal atrophy are higher than, are high normal. They're not abnormal, they're not diabetic range, they're regarded as normal, but they're the higher normal range of blood glucose. Higher blood glucose levels are associated with poorer memory and reduced hippocampal microstructure. And high normal blood glucose is associated with decreased brain volume and cognitive performance when people are in their 60s. So the damage is being done at blood glucose levels that we regard as normal. We think 6 is normal. No, it's not. You don't have to be overtly diabetic to have your brain damaged by glucose. And the hippocampus, which is the seat of memory, is damaged by these higher than normal blood glucose levels. So we need to rethink what normal blood glucose is. So the question I'm asking is the cake worth it? It's not just a couple of studies that were done at our local university. There are multiple studies across other countries. And for example, here I give an Italian study, Tortelli et al., midlife metabolic process profile and the risk of late life cognitive decline, and a Danish study, Neergaard et al., 2017. So what these studies show is that insulin resistance increases your risk of cognitive dysfunction. And they point to the need to control blood glucose in midlife to prevent cognitive decline in later life. Moving up in the pyramid of evidence, because we all know that epidemiological data can only show associations and does not prove causation. Here are I reference here Pinto et al. 2018, which is a review of the clinical studies. Now, the clinical studies are small. Table 1 lists 7 small studies, and I've highlighted 2 of those. Krikorian et al. N equals 23, so it's actually quite a small study, but they randomly assigned patients to either a high carbohydrate diet or a very low carbohydrate diet for 6 weeks. And they found that ketone levels were positively correlated with memory and performance. There's also another study, Henderson, N equals 152. They gave an MCT oil-based ketone supplement and tested it against placebo. All patients stayed on usual medications. There were modest improvements in the ADA COG score. So that's one of the ways that cognition is assessed. These are small studies, but they're on humans, and they do point in similar directions. And the conclusion is that there is cause for cautious optimism. And from the paper Rusek et al., a quote, based on animal studies and limited clinical trials, ketogenic diet has beneficial effects for enhancing mitochondrial function and cellular metabolism, and is associated with improved cognitive performance in elderly adults with Alzheimer's disease. Outcomes depend on level and duration of ketosis. So what do we feed old folks in aged care facilities? Let's talk about preventing cognitive decline now. And this is the conventional view, and I took this from Medicine Today. Medicine Today is a journal which goes out to GPs around Australia. So it's a good indication of the kind of information that GPs are being given. So the conventional view of Alzheimer's prevention is the usual. Don't smoke, do some exercise, stay socially connected, keep your brain active, treat depression, avoid pesticides and heavy air pollution, don't burn down your forests, and address cardiovascular risk factors. So the cardiovascular risk factors are diabetes, high blood pressure, obesity, smoking, hypercholesterolemia, which is actually metabolic syndrome. And they also mention follow healthy diet. The BMJ, again from their June 2020 Food for Thought conference, also reviewed the evidence for the potential of food to reduce the risk of dementia, and this is what they came up with. Quote, given the established importance of cardiometabolic health and cognitive function, especially in midlife, greater adherence to existing dietary guidelines is likely to reduce the incidence of dementia. So they're telling us we need to do more of the dietary guidelines. Well, of course, what we know is that the Australian Guide to Healthy Eating is not exactly what we in the low carb community would regard as being follow a healthy diet. What they're saying is to prevent Alzheimer's disease, follow the same dietary advice that gives us metabolic syndrome, which increases our risk of dementia. I'm arguing that whatever a healthy diet is, the Australian dietary guidelines are probably not it. From a low carb perspective, what I reckon is that there is modest evidence to support the idea that ketones are neuroprotective, and that some kind of caloric restriction, such as intermittent fasting or time-restricted eating, probably helps. And in an elderly person, if a ketogenic diet is too hard, you might consider a ketone or MCT oil supplement, and at least get them off the tea and bickies. Okay, in the last few minutes of this presentation, I'd like to talk about the work of Dr. Bredesen. He wrote a book called The End of Alzheimer's, and he makes a big promise, the first program to prevent and reverse the cognitive decline in dementia, and note the term reverse. I'm using Dale Bredesen's work as an example of someone who is thinking more broadly about diet and brain health. He's also, I guess, within the establishment, he's actually a neurologist. There are lots of other authors talking about this approach, and another example would be Amy Berger and her book, The Alzheimer's Antidote. But let's just talk for a few minutes about Bredesen. Bredesen went back to basics, and he asked what causes Alzheimer's disease? What is known about the cause of Alzheimer's disease? And what he comes up with is that metabolism is the key. That there is also inflammation, which is contributed to by diet, infections, and immune dysfunction. Nutrition is important, brain nutrients, hormone, and the cognition supporting molecules, and also toxins and things that damage brain cells. And the key concepts here are that there are multiple targets for intervention and that metabolic status can be manipulated. he mentions the failure of the medical model. The medical model is that for every ill, there's a pill, and quite frankly, in Alzheimer's disease, there are no pills that target the multiple processes involved in the causation of Alzheimer's. And as we've seen, medication can mitigate symptoms in the short term, but does not address the cognitive decline. Bredesen is arguing that you need to target multiple pathways simultaneously. And a really critical part of Bredesen's protocol is reducing insulin resistance, restoring insulin sensitivity, and reducing glucose levels. This is a diagram taken from one of his papers, and what this is demonstrating is the idea of amyloid precursor protein as a molecular switch. So in the middle of the diagram is the amyloid precursor protein, and it is cleaved. Which way the process goes depends on the total metabolic milieu. On the left, one possible pathway is that it is cleaved into two spots, and that's into two separate bits. And that pathway is trophic, meaning it feeds brain cells and is anti-dementia. But in certain metabolic conditions, it will cleave into 4 pieces, and one of those pieces is the amyloid, the beta amyloid, the stuff that's toxic to brain cells. Which way it goes depends on a whole number of things, including all those risk factors that we've talked about: the inflammation, the nutrient availability, the metabolic health, or the metabolic ill health. So what Bredesen does, and this is a summary of his therapeutic program from, I think, his 2014 paper. The first thing on his very long list of interventions is a low carbohydrate diet to induce mild ketosis. Bredesen's subsequent work goes on to say he's more a fan of Mediterranean plant-based meat as condiment kind of approach, but he's very clear that the rationale is about reversing insulin resistance and enhancing the neuroprotective effects of ketones. It's an anti-inflammatory diet. Note that one of the things that he says is no grains, and this is actually quite radical compared to the usual dietary guidelines that we get bombarded with. The second thing on his list is fasting, or at least 12 hours overnight, to enhance autophagy and ketogenesis. Now, for those of us who are in the low-carb community, fasting at least 12 hours overnight is not a big ask. These are pretty familiar concepts. He also talks about reducing stress, optimizing sleep, exercise, 30 to 60 minutes per day, 4 to 6 days a week, brain stimulation, a number of important nutrients such as B12, an anti-inflammatory diet, optimizing omega-3. He wants you to get your HbA1c below 5.7 and your insulin, below 5.5 and your insulin below 7. The whole protocol is quite complex and demanding, and so it includes a range of things, lifestyle measures. He says you don't have to do every single bit, but the aim of a Bredesen protocol assessment is to identify which bits are relevant. So, does it work? Bredesen has published in 2018 a case series documenting 100 cases, and it documents improved function, improvements in subjective and objective cognitive function, and in some cases increased hippocampal size on imaging. So the conventional view is once you lose brain cells, they don't come back. What he's saying is that he has shown that hippocampus size increases in some people as a result of doing the Bredesen protocol, and he suggests that the pathophysiological processes of Alzheimer's may be reversible. This is a really big claim. He also says that the major side effects of the protocol are optimal body mass index and improved physical health, because we all know that your brain is connected to your body. And if you're improving your brain health, you're going to improve your body health and vice versa. The big criticism of Bredesen is the cost of the process, and also there is a lack of randomized controlled trials. But I guess what I'm trying to get across here is that Alzheimer's disease is a consequence of a complex network of interacting processes in the brain. Consequently, there is no one single intervention that will cure Alzheimer's disease. I personally think a ketogenic diet is probably a good start, because we know that we know about the beneficial effects of ketosis on the brain, but it's only it's one part of the solution. It's not the only thing, and the other lifestyle stuff is in fact important, and that's pretty much the same thing that you get in conventional advice, minus the grains. So what I'm going to conclude with is say no to cake, unless of course it's keto cake.